Located in the heart of Dublin's north inner city, one place has provided acute paediatric care for almost 140 years. A home from home which offers safety at times of uncertainty. This building tells a story of hope, determination and strength. And tonight we go behind its doors to share the stories from the theatres and wards, to meet the staff who dedicate their lives to the care of Ireland's children, and to follow the journey of families and their little patients who are in need of vital and life-saving treatment. Welcome to Temple Street Children's Hospital. Monday morning at Temple Street. As a new day begins, in the hospital's intensive care unit, 12-year-old Keelan recovers after surgery.
He was great, normal, everything, into everything. Just a normal baby, as babies are. Never cried very much or never gave out very much. But then, unfortunately, he got into the press one morning and he took a drain cleaner that contained caustic soda. It was early in the morning. He was in the kitchen with his sister and I was in the bathroom. And he just got it and took it. Whenever I come out of the bathroom, when I picked him up off the floor, he was screaming. Like, I could actually smell him burning in front of my eyes. Like, I didn't really realise what he had taken. It was like crystally stuff. I didn't know what was in it. So he was brought to Sligo General Hospital and he was intubated and he was brought straight to here where they'd done lots of surgery on him.
Keelan suffered an acid burn to his mouth and upper esophagus and trachea. When he was 18 months old, he ingested some acid. The acid burnt most of his lower lip, skin of the inside of the mouth, including the tongue and the gums, and then also the upper airway, which includes the upper part of the esophagus and the trachea, which is the windpipe. This had a number of very significant aspects to it. First of all, was the whole area of his airway and breathing, and as a result he needed a tracheostomy to secure that. The next problem that he had was in terms of feeding, because he couldn't feed for a significant amount of time. He couldn't take anything through his mouth, so he then had to have a tube put in to allow for some tube feeding. He had a huge number of operations. In fact, by the time I had met him, he'd had 50 operations, which were all essentially to try and get him over the very significant growth period between the ages of 2 and 7 or 8. And these included stretching of the esophagus, skin grafts to the burnt skin of the mouth. But it became quite clear, however, that by the time he was 8 and 9, because of the continued growth, that the scarring was causing very significant issues, and one of the major problems was now that it was affecting the growth of his facial skeleton. We planned for a major operation for him, and this major operation was to get him to open his mouth.
51, yeah.
After undergoing reconstructive surgery, today, some 10 years since his original burn, Keelan will undertake his 51st procedure.
Minutes. That's all it was, like minutes. He was in the kitchen with his older sister, who would have been about 5 or 6 at the time, like. But just all from there, Keelan's had a hard road. So we have to keep reminding him to press the button.
Come on, Michael. Good boy.
Meanwhile, downstairs, a regular visitor has arrived at the hospital and is making his way to the day ward.
Hi, I just said the video taken. My name is Michael. My age is 9. I get my needle in my hand to make my bones be strong.
Michael's come in to us today from St. Michael's House. He comes in every 4 to 5 weeks. He has a condition known as osteogenesis imperfecta. It's more commonly known as brittle bones. And he comes in for a medication to help strengthen his bones and also helps with pain.
Actually, when
You were getting your Freddie in last week. Where did you have it? Do you remember?
In my hand.
Your hand? Not your foot?
No.
Children with this condition tend to break their bones a lot more easily than other children. Bone growth isn't the same. It's just part of the condition that they would be small in stature and that he wouldn't be able to walk.
Give us your
12.2.
12.2.
Are you getting bigger?
We go back to the bed? Is that all right?
Yeah, on the bed.
Now, other children might be able to walk with the condition, other types of the condition. He's in a wheelchair and he very independently gets around in his wheelchair. He brightens up everybody in the ward, not just the nurses. Everybody just delighted to see him.
Are you smiling?
Oh no.
Are you smiling, Michael?
He's such a great child, so outgoing and happy. He never lets things get him down, and he's always, playing with different things, and he loves movies, and he's always watching movies when he's in.
Are you not going to watch telly today, no? You're having too much fun, are you?
Yeah.
Yeah.
I have to get videos.
You're getting videos? Yeah.
This today.
In St. Philomena's ward, Mum Olivia is waiting with her newborn twins, Ben and Cian.
They were 11 weeks yesterday, so they were born premature at 34 weeks. Ben was 4 pounds 14 ounces and Cian was 4'10". They spent a week in special care unit in Holles Street and then came home. They were doing well up until about 6 weeks, and then we noticed a swelling in Cian's groin area, and then when we had a closer look at Ben, we noticed he had it too, so we came to Temple Street that night and they confirmed that they have hernias. So Cian has a hernia on both sides and Ben has a hernia just on one side of his groin. So they're coming in this morning then to have it operated.
Today, both brothers will undergo surgery for protruding bowels. And as Cian begins his journey, Mum waits with Ben.
Literally, they should have been born last week. They're now over 6 weeks of age. They were referred to me with hernia, and the fact that they were preterms, we elected to do them as soon as we got their referral. A hernia usually is painless. It can come out and be pushed backward without any pain or without any struggle. Sometimes you cannot push it backwards, and in that scenario then it becomes irreducible hernia, and this can lead to a lot of discomfort.
Their father had hernia problems as a child as well, so I had a fair idea that it was simple enough to rectify, but it was still a bit frightening at the same time. The fact that they were premature, we were told that it's quite common in premature children, especially boys, so. It's nice that they're together, which it would have been harder actually to separate them because they're never separated, but still it is hard with both of them being put asleep. I think that's the hardest part about it.
Upstairs in intensive care, Keelan is also beginning his journey to the operating theatre. Once inside, Mr. Murray will begin to investigate Keelan's wounds.
There were two main reasons that we chose to operate on Keelan at the age of 12, and in essence the first one was that he was now completely tube fed, dependent on this tube for all his nutrition, and also he was unable to breathe through his mouth properly. So the idea and the purpose of the surgery was to try and get rid of both the tube and the tracheostomy by getting his mouth open. And one of the things that we had noticed as well was that there was a significant restriction of the growth of the upper jaw, which, if it persisted, would have been a major problem for him in the future. The plan of the surgery was essentially to remove all the scar tissue that he had, but also to disconnect the muscles that are around the jaw and cause the jaw to open and close. And the reason that we have to disconnect all these muscles is that because he had remained closed for so long and wasn't using his mandible in the normal fashion, all the muscles have become quite tight. Once that was done, I was able to get his mouth open by removing all of the scar tissue and the muscles. We then had to replace that tissue. And in essence, what you have to do is to replace the tissue with skin that is supple, soft, is able to grow as he continues to grow. And really the only way that you can do that is by taking skin from a different part of the body with its blood supply and connecting it to a blood supply in the head and neck area. So in his case, because of the nature of his skin, we decided to take it from the forearm. So I'm just going to open up this dressing. Once he had had the major operation, we then had to change his dressings, clean his mouth, because essentially he's not in a position to clean his mouth, and change the bite block, and that's why we took him back to theatre. He had a skin graft placed on the donor site where we had taken the skin for his mouth, and that needs to be inspected after 4 or 5 days to make sure that everything is okay and that it's healing nicely.
It's so much surgery here at the start, I don't even remember. It's all like a blur, most of it. I don't remember an awful lot about what happened at the start. All the burnt tissue inside, when it was healing, it all shrunk up and it was kind of stuck to the inside of his mouth, and his mouth just wouldn't open. Just a tiny, tiny little bit is all it would open. Wasn't a whole pile of hope for Keelan. They didn't think he'd make it. They didn't even think he'd make it from Sligo to Dublin. They told us that. They had kind of prepared us for that. He was anointed and everything in Sligo. I thought, of course he's going to make it. Like, don't tell me things like that.
So this is the area from where we took his skin from the arm. Many of these children that have a very significant injury and in essence have multiple procedures, they do become sensitive to what might need to be done, and they are certainly very aware that when very significant problems occur like this, there are really very dramatic procedures that need to be undertaken to try and overcome them. And one of the very important issues here is that Keelan himself is 12 years old. He fully understands what's going on, and he himself wants the surgery. Other problems, which hopefully are much smaller, and he does have a very significant scar in his arm now. The function of his hand and his wrist is not a problem, but there is a very significant scar on his arm. So he would have been made aware that that's one of the areas that we can take tissue from. We could have taken it from somewhere else in his body, but unfortunately that skin and soft tissue that was there wasn't thin enough, and we needed a very thin layer of skin. During the operation, we were able to get him open to 4 centimetres, which is almost what one would expect for a normal boy of 12 years of age. So he is now in a situation where he can open fully. The tracheostomy, we're in a position to take it out, and he has now started feeding. The other very important issue is that we are now able to get into his mouth so that the dentist, for example, can treat his teeth, which had significant issues, including lots of decayed teeth. Just going to give everything a good clean here. As you can see, his mouth is wide open, and when we initially brought him to theatre last week, he couldn't open at all. So we've managed to get it open to approximately 4 centimetres. In order to maintain him open for the first 2 or 3 weeks, we put in what's known as a bite block to try and keep him open and make sure that he doesn't close during that healing period.
Told me he was afraid it wouldn't work. That was his biggest worry. He's always afraid of being sore. The doctors always reassure him like that they'll make him as comfortable as they possibly can, like, and he won't be in pain.
Great. All done and dusted.
Like, I've always just wanted the best for Keelan. I want him to live a normal life and be a happy boy. And have a girlfriend and, you know, get married, have kids and live happily ever after. But it just be very hard when they're in there. You'd be kind of half thinking what they're doing to them and, you know, the pain that he be in whenever he comes out. I seen his tonsils yesterday for the first time since I don't know how long. So I was pretty impressed. The doctors are very happy with how it is and how it looks. So just another while when it's all healed up, hopefully he'll be like a new man, won't you? Yeah.
Back in the day ward, Michael is ready for his medication.
I saw a friend today and he works here in Temple Street.
That's fine. We'll just go ahead and do the IV cannula now.
Michael is a little man who has brittle bones, so unfortunately he's prone to regularly having fractures. Not only that, these kids frequently had pain in the past or some sort of discomfort, and it's very difficult for them to verbalise it. So they would regularly come into us acutely when they had another fracture. So we would have seen him over the years with fractures.
No. All right. Oh my God. All right. So. Oh, come on. I haven't done anything.
More recently, they have discovered that some of the newer drugs that are around seem to reduce the number of fractures they get, and it was noticed that it makes them more comfortable.
Don't make it too tight.
All right. As you say, I won't make it too tight.
So Michael comes in regularly to get his medication to try and reduce his fracture frequency primarily, but as a side effect it seems to make some of them more comfortable.
I want to have a look at my blood. Can I? Where do you have to put it?
Sorry?
Where do you have to put it?
I have to check whether you are fine or not, you see?
It's very difficult medication to take, well known that it can cause esophagitis or burning in the tummy. So the kids come in every few months and they get through a drip without having that side effect.
Right, here you go. Nice, sweetheart. Give us a go at this.
Can I hold that for you?
I heard that. Let's turn around.
He's small stature, probably had discomfort getting around that he finds it difficult to verbalise. So if we can keep him comfortable, reduce his fracture frequency, and thereby reduce his problem with deformities. Every time they break a bone or repeatedly break it, they may not heal perfectly, so over time they become progressively more deformed. It hasn't been determined exactly how long we're going to keep these children on such treatments. Now they're thinking about keeping them on it for maybe 2 to 4 years and give them a break off it. So they need to be followed up into adulthood. Many of them have fewer fractures as they grow older. So their most common fracture time is when they're younger, so if we can get them through that phase and get them into adulthood, they won't grow very tall, but at least they won't have as many fractures.
You have to sing along now.
Why?
Because.
No, you do it.
We'll do it together.
Over in St. Philomena's ward, Mum Olivia continues to wait with Ben while Cian is in theatre.
It's hard, you know, you're just nervous and hoping that he's okay down there, and you're just thinking of him. But I know he's in safe hands, and the staff are brilliant, so I feel confident, you know, that he'll be okay. My waters broke and I wasn't expecting them to arrive at 34 weeks. So it was pretty scary. It was lovely to take them home. I left on the Friday and they didn't come home until the Tuesday. So it was hard to go home without them. You know, for a new mum, everyone gets to leave the hospital with their babies, but we didn't, so that was hard.
And as the second brother Ben travels to theatre, Cian is settled in recovery.
The procedure is very simple. It's an incision in the groin, and we try to separate the hernia sac from the spermatic cord and ligate it so that the bowels don't find any way to herniate again. And that will be our main objective. It's just for parents' convenience that we did them together so that they go through the same procedure, and then the post-operative care would be much easier for both of them to be done at the same time. The fact that they're both twin brothers, it makes it more likely to have this kind of hernia. They'll be fed immediately after going back to the ward. By tomorrow, they'll be re-examined to see if there's any bleeding or swelling.
The house was full constantly, lots of visitors, but they're very quiet babies. Like the first few weeks they just slept constantly, and they're a lot more alert now. I found out at about 7 weeks that I was expecting twins, so it was a big shock, but it was a nice shock. They were able to tell straight away because they were sharing a placenta, so they were able to tell straight away. That's indication then that they're identical. I knew it wasn't a big operation, but it still was a bit scary. I'm just glad now to get them home and let us know it's done now. Hopefully that's the last time they'll be in hospital.
The next day, Cian is recovering well and looking forward to going home.
Cian will certainly require more surgery in the future. We're certainly going to give him a long break following this, and there will be some minor adjustments to the tissues that we've put into his mouth. He will need a huge amount of training to get him to open and close. And the next major step for him will probably be a procedure to realign the jaws.
It's been a long road and very hard, but it's starting to come good. Like, it was worth it, you know, if you know what I mean. Healing's always appointments here, there and everywhere, but I'd do it all again tomorrow if I had to. You know, the accident happened. If there was anything I could do to change that, I would. I used to really beat myself up about it for the first couple of years, but I spoke to people on that, and people just said, well, there was nothing I could have done to change it. But yeah, there was for a long time I beat myself up really bad about it.
You alright, Mum?
To be able to move, yeah. To be able to move his jaws up and down, like, to open and close his mouth. It's good, isn't it, Cian? He's sitting thinking every day, what am I going to eat when I get home that I could never eat before? So
I'll give you another tray so we can keep.
My best hope would be that he would feed normally, be able to go out to restaurants and feed without having to worry that he's going to aspirate or that that the food is going to essentially slip out of his mouth. Obviously, with a young man at that age, you want to make sure that he's able to get on with his peers and interact with them and develop socially, mentally, and physically as much as he can in a normal fashion.
Why do you think
I'm not sure if he understands the extent of how sick he was. He knows he's lucky, but I don't think he realises or understands really how sick he really was when he was smaller. Doesn't really plan for the future or think of what might be next or whatever, he just takes it as it comes. There's a light nearly at the end of the tunnel. You can nearly see the light. You do move on, you have to.